Hi, this is Chloe with Happy, Healthy, and Homegrown, and today I'm excited to bring you this interview I did with naturopathic nurse Nikki, who has seen over 600 COVID patients in their home and has a wealth of insight. We did this interview on July 3rd at Clean Juice in Gilbert, Arizona. She has a lot of great tips in here as well on preventative measures you can take at home to keep your body strong and healthy. And if you are in the Phoenix and East Valley area of Arizona, at the end of this video, you'll be able to find her information if you are looking for a holistic naturopathic nurse that can do at-home visits. So I'm excited today. I'm going to interview Nikki, and she has her picture on the wall right here. And she is a holistic nurse, and she's going to be talking to us about how she's been treating COVID patients in their homes. So Nurse Nikki, thank you so much for meeting with me today. I'm so excited to hear your experiences with this.
Thank you for having me.
The results. I was wondering, one, what kind of treatments you use and what kind of success you had and how that compares to other viruses you've treated in the past, other kinds of bugs that you've treated in the past, and then how your patients have responded and kind of the differences and similarities that you've experienced with this?
Sure. Okay, yeah. So first of all, I have a team of medical directors that are behind me that are naturopathic doctors, nurse practitioners, and whatnot. So I'm not out here just doing this by myself, so I want to preface that by saying that. But yes, definitely I'm mobile, so I do go to patients' homes often, and I've seen with my own two eyes, experienced obviously a lot of COVID patients. So one of the things that I've been doing for the COVID patients are IV drips. So IV vitamins to boost their own immune system so that their body can fight. So it's not a treatment, it's not a cure. We are not, stating that, but we're stating that this is something that has been helping patients. I've seen it where patients are better the next day all the way up to a week. So it just depends. Typically patients need one IV vitamin drip, and if not, then the patients call back for another, but that's actually pretty rare. One drip is usually enough for the patient to start boosting that immunity and getting better. There's also a list of supplements that we give the patient to take, and all immunity boosting, lung supportive, and all of those things. So,
wow.
Yeah.
So you do IV drips, and then you give them supplements, and a lot of times they're recovering in 2 days to a week.
Yep.
Generally.
That's correct. That's what we've seen personally in our experience.
Yeah.
Yes.
And on average, how sick are the patients, and also how sick are they compared to other viruses that you've experienced?
That's a very good question. So it just depends. Out of over 600 people that I've seen with the virus, it's been all over the map. There's not been one cookie cutter person. So I've had a handful of men specifically that were asymptomatic completely. And then I've only seen 2 females that were asymptomatic, so where they didn't show any symptoms at all. But it varies from I have a fever to chills to I can't feel my fingertips. There's a lot of different symptoms that are out there right now. And like I say, none of them are a cookie cutter, so no one is exactly the same. Everyone has been very different with the symptoms that they experience across the board. Some even do not have fevers. Some are the virus, they're testing positive, and that positive result when they retest is still there after 14 days, and some are testing positive, and then after 10 days they're testing negative. So it's really, really been different for every single person. Does that answer your question?
Yeah. Okay. So when you have someone maybe that's, how have people responded who seem a little more out of it, like they have a high fever, or they seem really run down?
How have they responded to IV drips, or how have they? Okay,
yeah.
Good question. So very well, actually, to be honest with you.
Yeah.
To be really honest with you, very well. In fact, I had a patient recently who had 104.4 degree fever. I gave him an IV drip, and the next day he called me and he was at the lake. Now, here's the disclaimer.
Yeah.
We did tell him to quarantine, right? As doctors and nurses, we said you need to quarantine at least 72 hours. He was still febrile, so he was still contagious. CDC recommends 10 days, so we did recommend that to the patient, 10 days of being symptom-free.
Yeah.
He went to the lake. That's not my fault.
Yeah.
But the point is
that
the patient felt well enough the next day, literally, to go to the lake, even though he had 104.4 fever the day prior.
Wow.
Yeah.
Hopefully he stayed away from people while I was there.
You know what, he did. I followed
Sure.
up because I did get a little bit of slack from that. People were thinking that I'm just getting people well so they can go have fun.
Yeah.
But that's not the case. We're not recommending go out and have fun. We're just trying to get patients well. That's the goal of any provider or nurse or doctor or anything, is to get their patients well. So that's our objective.
And the outdoors is good for people.
It is good for people.
Especially, and there's plenty of air out there. You don't have to be crowded.
Absolutely, yeah, absolutely. And like you talked about earlier, de-stressing. Stress is a major factor of all kinds of ailments. It's even been linked directly to cancer. So people, you know, don't worry about things. Try not to stress about things. I've had a lot of patients call me with anxiety, you know, about the virus and things like that. A lot of fear based around it. And that's basically our advice is, yes, you know, be mindful, be aware, be careful, but try not to be fearful. Try to, you know, just be careful and not put yourself in that stress mode that sometimes people can put themselves into. And then they do tend to get sicker when they're in that stress mode and they're not taking care of themselves. So supplements, vitamins, immunity boosting, reduce your stress, try to take care of yourself. Yes, go get some fresh air, stay away from people, wear your mask as you should, but definitely be safe.
Yeah. So when people have, say, a panic or extreme fear, is there things that you say to them that really kind of give them peace or help them just take it in stride and not be so overwhelmed?
Absolutely, yeah. So a lot of, they want to be in the know. They want to know, you know, is this virus affecting most people in a negative way? What's happening? What are statistics? That kind of helps people to understand, like, yes, there are some people that are having extreme problems. Then there are other people who are, the majority are getting better. You know, they are getting better. But mostly what I do when the patient's having anxiety is I help them with supplements. So there's a couple of supplements that the patients can take to help with anxiety that are natural supplements. We don't prescribe medications. My team of doctors and nurse practitioners, unless it's absolutely necessary. So there are natural supplements. We also suggest that, of course, like we said earlier, go out and get some exercise. That's one of the big things. Believe it or not, praise and worship has been proven to decrease stress and to help people with anxiety. So we tell them, you know, there's a whole recipe that goes with that. There are people who have different, you know, gods, or they have different beliefs or what have you, but all of us have a sense of where we draw our hope from and who we look to for support. So
that's good.
Yeah,
tapping into your faith.
Right, absolutely. Tap into your faith.
And that brings
praise
peace.
And worship. It brings peace. It releases endorphins in your brain, serotonin and dopamine that are your feel-good hormones. They help you to feel better. So exercise, praise and worship, getting out there and getting some fresh air, doing something for you that makes you feel better. Go get a, you know, like you said, go walk around or read a book or, you know, do your nails at home or whatever that looks like that makes you feel good. Yeah, for sure.
So for the average person out there who doesn't live in our state and can't call you up if they are feeling run down, is there like general vitamins that are always kind of good for the average person to look for? Is there certain ones that you like best?
Right, very good question. So during this, especially right now, so there's beta carotene, 25,000 IU per day. That strengthens the lungs. Obviously, vitamin C. Everyone has a different vitamin C tolerance.
Vitamin C?
Vitamin C, ascorbic acid. So you're looking for more natural supplements, not necessarily man-made supplements. So for example, beta carotene is vitamin A. It's a natural form of vitamin A. There is a palmitate, that's a man-made form of vitamin A. So I always recommend to my patient the 25,000 IU of beta carotene per day. There is liquid also for children, so children can take it also. And it's also helpful for children with allergies and asthma-induced allergies as well. So asthma, you know, it strengthens the lungs like we talked about with the beta carotene. So the vitamin C, the ascorbic acid is also very helpful. And like I said, everyone has a different tolerance to vitamin C. So the way to test your body is to start out slow. Let's say you start out with 1,000 milligrams of vitamin C per day. Once you get to a point where you may be having a little diarrhea, then you back down on the dose because that means you're taking a little too much. You can take it in 3 divided doses per day. Patients are also taking zinc with that. They're also taking vitamin D. Be careful with vitamin D. You should get a blood test before you just get on a supplement of vitamin D, just in case. You don't want to overdose yourself on it. It is fat soluble, which means it doesn't just flush out of your body like vitamin C that is water soluble. So I recommend getting a blood test for vitamin D first. And if your doctor or your nurse practitioner recommends you take a vitamin D supplement, definitely do that. organic and raw. I like Garden of Life Organic Raw Vitamin D. It's a good brand.
Yeah, I like that one.
And then also just, again, so recap, beta carotene for the lungs, vitamin C and zinc for immunity. You can also take echinacea with GOLDENSEAL. That's a great one to take. All of those supplements in combination together help with immunity, help with lung support, and are going to hopefully keep you well, or help your body to boost its own immune system so your body can fight if you were to contract the virus.
Yeah. Do you think sunshine is really helpful?
Sunshine's very helpful. It really is. Anything antiviral also that's natural. So lemon balm is a nice natural antiviral. L-lysine is a natural antiviral. I always recommend liquid form of the L-lysine for antiviral. So, yeah.
And so, do you have any specific stories that maybe anyone who's had a dramatic shift? I know you shared the guy that had a really high fever that was feeling amazing the next day.
Right.
Do you have anyone you've been really concerned about who you've seen a dramatic
Oh yeah,
changes?
absolutely. Yeah, I did have a patient actually 2 days ago who had tested positive the week before when I tested him for COVID. He had tested positive. And he was asymptomatic, completely asymptomatic. In other words, he had no symptoms at all. And he called 2 days ago and he said, this virus just hit me hard within the last 10 minutes. I need you to come give me an IV. So I went to the patient's home, gave him the IV. I also gave him a vitamin D shot. And then after, I could tell that he was still feeling the same way. He was already too far at that point. He called me when he was in a crisis, basically. And, to where he was stumbling when he got up. He could possibly fall and hit his head. He was telling me that he was having vision changes, olfactory changes, numbness in his fingers, things like that. I just knew as a nurse, my assessment of him was he needs more care right now, such as oxygen. I checked all of his vitals, his pulse ox, listened to his heart rate. It was elevated, blood pressure elevated, etc. So at that point, my job as a nurse is to get him a higher level of care. So we were able to get an ambulance in there. He did go to the hospital. We released him that night. Because they are beginning at this time to stage patients, and they're doing that because they have to, because hospitals are at capacity right now. So it definitely is something serious that you need to be careful for, but taking precautions is a really good idea.
Right.
So this particular patient went home that night. He was still ill, but they just had to send him home. He called me 2 days after and said, thank God you gave me the IV and the D shot. I feel so much better. But when I had seen him, he could hardly even sign. He was just very terrible. He had, that virus literally he was right, hit him very, very hard. So yes, the fact that, in the hospital, what they did for him was just give him IV fluids. So the fact that the IV drip and the shot helped him after it kicked in for his body, his immunity was able to fight against it, was very, very exciting to hear that. Because you, as a nurse and doctors in the practice and nurse practitioners, we worry about our patients and we check in. When you're someone that actually cares for your patient, you check in, you care, you worry. And so I kept checking in with him. It's just so exciting to hear that he got better and that he's on the road to recovery.
Yeah. So in the past, have you experienced like flu seasons and other kinds of bugs that have been intense for people and where they've had some serious issues as well?
Yeah, definitely. Flu season is one of those seasons that's also intense for people. Nothing like this. Obviously, none of us have seen anything like this. This is different. But flu season is also, a time for people where many people are getting sick. They're experiencing some of the same symptoms like fever, nausea, all of those symptoms that some people are reporting to feel right now with COVID as well. So yes, we have experienced that season as well. Yeah.
In the past too. How long have you been doing this?
Oh gosh, so I've been a nurse for I think 8 years, 9 years, something like that.
Okay.
This particular avenue, it's been about 2 years that I've been doing this.
Holistic practice.
Mm-hmm. Yeah, so it's been, and I have people ask me all the time, how did you become a holistic nurse or naturopathic nurse? And it's definitely a unique idea. There's no one out there in the field that is mobile like I am as a naturopathic nurse. And with my own team of medical directors, and it's really been fun. It's creative, and people like the service. They like that, I'm going to them. They don't have to leave their home when they're sick and they don't feel good. So they like that I'm coming to their home and that I'm taking care of them at home.
like you used to see in the old movies. The doctor comes to your
Yeah,
house.
that's right. Yeah. It's kind of like a dying field, but we're bringing it back and
I
helping
hope
people at
so.
home.
You know, when I heard about what you did, I thought, wow, I wish there was a bunch more people like you. Like, it's just so cool. I'm like, where can I find one of you in all the states where my relatives live? Because
Right.
like what you do and just the stories I've heard from other people has been, they've just had a very good experience and just really appreciated it. So
Thank you.
I really think what you're doing is amazing, and
Thank you.
and I hope you inspire more people to become holistic mobile nurses like
Yeah,
you.
I hope so. Actually, here within the next couple of weeks, I will actually be hiring. So I'll be hiring
wow.
nurses to go out and do the same thing that I'm doing.
Yes,
Yeah.
I love that.
Yeah.
That's amazing.
Very exciting to grow.
Yeah.
Yeah, and to offer the opportunity for other nurses, because again, many nurses have asked me, the same question. How can I do what you're doing? So now we found a way.
Yeah. And I love that you have the medical knowledge, but also the holistic knowledge, because so many times people want to know that somebody has the medical background and kind of understands when something's serious,
Right.
but then also has the holistic knowledge, because the body is not, we don't want to just cover up symptoms while the body tries to get better, but we also want to
Right.
support the immune system, support the whole body.
Absolutely.
And I know a lot of people, like even just taking, big doses of vitamin C myself at home, I've gotten better quickly, and I'm like, oh wow, this really works.
Right.
And so to have a nurse like yourself who knows the dosages and different things you can give is amazing.
Thank you.
Yeah.
That I feel like is a good benefit to the patients as well. That they, so if you were to go see my doctor, for example, in his office, you're going to pay about $300 to $600 to see that doctor. When I go to the patient's home, I'm much cheaper, but I still have the team of experts behind me as well. So we put our knowledge together. You're still getting everybody in one, but you get the service and you get it for a lot cheaper cost as well. But you're absolutely right. Just being able to have the best of both worlds has really been beneficial too, because medicine has its place, but if you can try something natural first that's going to help you, why would you not do that?
Yeah, and even both together, like you're
together,
the
sure.
guy who got the vitamins and went to the hospital, like
Right.
there, he probably had a better outcome because he had the vitamins first.
Right, he definitely did, and having that ability to assess that patient as a registered nurse was important. I knew and I recognized his vitals are off, and if I leave him to hit his head, that's one of the things that as a hospital nurse, when I worked in the hospital, was a concern. What if somebody hits their head, airway falls, they're big issues.
Yeah.
And without that experience in the hospital that I did have, maybe I wouldn't have recognized that. Who knows? But yeah, they're both invaluable. Hospital experience, hospital nurses, and me being a nurse out here, both I think are invaluable fields. Kudos to my hospital nurses as well. They're really, really working hard right now too. So, but I really appreciate the nurses that recognize that I'm doing the same and that we can work together as a team. So
how much extra training did that take to make that transition for people out there who are in nursing and just
Sure.
love to make that transition?
Yeah, that's a very good question. So yeah, definitely do need training. When I started out, I started in a naturopathic cancer clinic when I first started as a brand new nurse, and I worked there for a while. And that's where I learned my hands-on experience. And then throughout the years, it's always been an interest of mine. I've continued to maintain classes, etc., and learn from other doctors, naturopathic doctors and other medical professionals who are in the naturopathic field. That's been a mission of mine for the entire 8 to 9 years that I've been a nurse. And so it does take a while to get that training going. With your team of medical doctors and naturopathic doctors behind you, though, nothing's impossible.
Yeah.
So it's definitely possible to become a naturopathic nurse. But just like a nurse that works in labor and delivery, she didn't have to get certified specifically to be a labor and delivery nurse. She's already a registered nurse.
Okay.
She works in that field and she's trained on the job in that field.
Okay.
Now she's a labor and delivery nurse, if
Right.
that makes sense.
Yeah.
So just like becoming a naturopathic nurse,
Yeah.
my nurses that are under me, they train as a naturopathic nurse,
Yeah.
learning what we already know.
Yeah, and that's the best way to learn, is somebody who already has the experience.
That's right. Yes, exactly.
And somebody who you can call with experience.
Right. Yeah.
Yeah.
That's right.
Well, one of these days I'd love to interview you about all the other kinds of things you've seen, and is there anything you've really specialize in, or anything you see that is really something you specialize in or take care of a lot, or just have a lot of breakthrough with?
Right, so definitely yes. IVs are predominantly the big business for me right now. COVID testing, antibody testing has been a really big business right now as well. But that won't be forever. So back to, we do consultations in patients' homes. So I'll go to the patient's home, I consult with them. My doctor calls them prior to, so he introduces himself, and so they know that he's on the team, and we're working collaboratively for the patient. So consultations, blood work, getting to the bottom of the patient's issue. Like you said earlier, we want to get to the root cause and fix what the cause is, you know, and fix the underlying issues. And so that's what we do as a team. We go in, we consult in the patient's home, and then we come together collaboratively, come up with a care plan for the patient with my doctor, and then deliver said care plan. So the patient can get on their supplements, change their eating habits. It's a holistic view of the patient so that they can change what they need to change to get themselves better. So that's part of what we do as consultative services. We do lots of different other things. I even do microneedling, which is medical grade microneedling for patients with melasma or severe acne scars. Microneedling, medical grade, is where the nurse can get into the dermis layer of the skin for the patient. The dermis layer is layer number 5. Most spas are not allowed to get into that layer unless they are a registered nurse or a registered esthetician, I believe, but don't quote me on that. But they can only get into the top couple of layers of the dermis. Well, we're getting into layer number 5. We're able to produce new collagen for the patient so that the patient can start to develop new skin cells. And that's the point of helping with melasma and acne. So that's another big business that we have right now. Also vitamin D injections, vitamin B12 with carnitine and MIT. A lot of patients want that for energy or weight loss. We go into the patient's home, we teach them how to juice, we teach them how to cook properly if they want to learn how to cook healthy meals. So there's a whole slew of things that we do that's not just one, you know, right now COVID is the big thing, but we have a lot of other services that we offer as well.
That's amazing, because what kind of doctor is going to teach you how you should be eating, right?
Right.
They usually don't even...
They don't learn nutrition. That's just not part of that's not part of their schooling. It is important though for preventative care, especially, or even for getting better. You know, if you have an ailment or a disease, I don't know if you've heard of Christine O'Jordan, celebrity nutritionist. I worked a couple years in her office as the lead nurse. I got to meet a lot of neat people, and it was a great experience. But through that experience, I was able to train medical students. They would send us medical students from Honor Health, and I would train them in nutrition so that they were aware that nutrition is preventative care for their patients. So integrating those two, medicine and nutrition, are very, very important. But when I worked in the office there, we were able to help many, many patients with thyroid issues with nutrition to be able to come off of their thyroid medications after, of course, checking with their doctor. But their doctor would make that final decision, you know, them and their doctor. But we would get them to the point where they had healed their own body with nutrition, and they were able to then get off medication. So yes, you're right.
Wow, that's my hope for the future, is that medicine and medical doctors are integrated with like a holistic approach.
Absolutely.
Where they at least have some understanding of nutrition, or where to send people to work on that part of their health.
Yes, amen. I agree.
Cool. Thank you so much, Nikki.
You're so welcome.
I wrap this up for today, and I hope we get another interview in the future.
Sounds good. Thank you, Chloe. Thank you.
And
you
I
have
really
a blessed day.
Thank you. You too.
Thank you.
If you live in the greater Phoenix area, be sure to check out Nurse Nikki and save her number for any of your friends who may need her services. If you enjoyed this interview, be sure to subscribe to my channel at Happy, Healthy, and Homegrown for all of my latest videos. Thanks for watching, and this is Chloe wishing you lots of health and wellness.